If you have tennis elbow pain that just won't go away, and if you are becoming frustrated, irritated, and even overwhelmed with your elbow pain, then this video is for you. I understand your pain. I understand how tough it can be. Life is already hard enough, and now you have debilitating pain with the most simple of tasks. Now you can't pour out a cup of water without worrying about something as simple as the positioning of your elbow because you're afraid that you're going to trigger your pain and you're going to be down for the rest of the day. If this sounds like you, I'm going to do the best that I can to help you. I have created a free playlist here on YouTube that you can access right now to help you master your elbow and return to living the life that you want to live. Today's lesson is on blood flow restriction training. Blood flow restriction therapy is a science-backed way to strengthen the muscles of your forearm and wrist in a pain-free, effective way. Building muscle and strength actually requires 3 critical things. Number 1, muscle damage. This is just micro traumas that you create to your muscles through training. Number 2, metabolic stress. This is typically achieved through high rep exercise. And number 3, mechanical tension. This is typically achieved through heavier resistance training. So with tennis elbow, the balance we are trying to achieve is very delicate. We are trying to stress the muscle and tendon, but we're trying to do so without overstressing it. Your pain is your teacher. Don't cause pain. Utilizing blood flow restriction bands partially occludes your arteries and veins, thus allowing the 3 previous things we just mentioned to occur easier. It allows us to build muscle strength and endurance with less force required, aka resistance, or effort than someone who is just lifting weights. This means that you are less likely to flare yourself up because you're using a very low resistance. You're using a very light weight that you can control with ease. But you are still getting the benefits of someone who is lifting a much heavier weight and pushing themselves really hard. I am going to show you a typical exercise routine that has led to the reduction of tennis elbow pain for many people. This is a typical blood flow restriction band. This is a pretty cheap one that I found off Amazon a few years back. For the best results, obviously this would be completed under the supervision of a therapist that really accurately occludes your arteries the right amount, that kind of thing. But we're just talking about things you can do at home right now. So you simply take the band, slide your arm in it, and then tighten it down to where it feels pretty snug. It really doesn't have to be all that tight. You'll notice it's not that uncomfortable, it just feels tight. When you get this on, you'll automatically feel more blood flow getting kind of trapped in your arm. You'll feel like you're getting a muscle pump. I'm not going to cover all the exercises in this video because I've got them covered in the rest of this playlist. Very light dumbbell, should have no pain at all with this. We're going to do a 2-second cadence for these exercises, slow and controlled. So that simply means we're going to rest our wrist off the edge of something. We're going to work on strengthening that extensor carpi radialis brevis. Its main job is to extend the wrist of the hand. So you're going to count a slow to 2. So 1, 2 on the way down. Bend the wrist down like this. 1, 2 on the way up. 1, 2, 1, 2. And you should be squeezing this dumbbell as tight as you can without pain. You're trying to flex your arm and get as much blood flow to the arm as possible. You can also do simply isometric exercise. Keep that wrist nice and straight. Press as much force through the hand as you can without pain. And press down and isometrically contract the muscles of the forearm. Trying to strengthen and cause a little bit of micro tears without causing pain. You are the expert on your arm. If it hurts, you shouldn't be doing it. You want to challenge yourself but not flare yourself up. There is no magic rep range that is going to cure you instantly of all your pain. But this is a tool that you can start playing around with to work on gaining function of your arm. You can also take a hammer, glue your arm to your side, Grip it nice and tight as you turn your palm down and then turn your palm up. Go nice and slow for this one. That's also a good way to strengthen your forearm. Another good one to do is keeping your wrist nice and straight. Just work on bicep curls. Get as much range of motion as you can without pain. Super light, so try to get that elbow as straight as it'll go without pain. For you, you probably won't get it all the way straight yet. You can do your palms up, you can do your palms neutral, and you can do your palms down. All 3 different positions. Slow and controlled 10 to 20 reps, gradually build it up. Something to keep in mind is there are contraindications. That just means reasons that could be dangerous for you to use these if you have like cancer or certain heart issues. So just be aware of that. It's always safer to consult a physician before beginning any kind of new exercise.